Hi, I'm Anina. I'm a lactation consultant at PRHC. Today I wanted to share the most important things you need to know about infant feeding. At PRHC, we support the Baby Friendly Initiative, which means we provide safe and evidence-based care for all families. Whether you choose to breastfeed, express milk, formula feed, or a combination of methods, we're here to help you make an informed choice that feels right for you and your baby. Why is breastfeeding recommended? Breastfeeding, whether directly at breast or expressed, has many benefits. Breastfeeding can save your family time and money. Breast milk is ready and the right temperature when the baby is ready to feed. For the breastfeeding parent, it can lower risk of certain chronic illnesses. It may delay the return of periods. For babies, they may have fewer infections, be at lower risk for chronic conditions, and reduce the likelihood of obesity later in life. But most importantly, your feeding decision is your own, and we will support you with respect and without pressure. Skin to skin and starting early. Right after birth or as soon as your baby is medically stable, we encourage skin to skin contact for at least 1 to 2 hours. This helps regulate your baby's body temperature, their heart rate, breathing, and supports early bonding and milk production. Most babies are ready to breastfeed within the first hour. A nurse will be at your bedside to help with positioning and latch. Continue to have skin-to-skin contact with every feed or just for snuggles. Another parent or support person can help provide skin-to-skin. The benefits of skin-to-skin continue for months, but is invaluable in the early weeks. Babies feed best on cue, not on a schedule. While your baby is in the hospital, start to observe for early feeding cues. The first feeding cue a newborn will show is rousing from a nap. The next, they will often start rooting, smacking lips together, sticking out their tongue, and bringing hands to mouth. This is your baby saying, "I am hungry," and if you feed them on their demand, they will often be more receptive to the feed, especially when latching to a breast. Crying is a late feeding cue, and they will often not be as receptive to feeding. Feeding early and often helps your baby stay satisfied and helps protect your milk supply. In the early few days, babies will not always show us their hunger cues. If your baby has not roused on their own 3 hours from the start of their last feed, wake your baby with some gentle skin-to-skin and try to latch or feed them. This will help teach them how often to eat, ensure they practice latching again, and help establish milk supply. Babies will also start to show us when they are full. Watch for when your baby appears full. They will be content with open palms. During your stay, our nurses and lactation consultants can help you. Position your baby comfortably, get a deep latch, effective latch, tell if the milk is transferring well, and identify signs that your baby is full. A good latch is one that is deep, not just the nipple, but areola and/or breast tissue in the baby's mouth. The baby should approach the breast nipple to nose and achieve an asymmetrical latch that is not painful. If latching is uncomfortable, seek further support from your nurse and lactation consultant. When bringing the baby to the breast, be sure not to push their head towards the breast, but rather support their neck while applying pressure between the baby's shoulder blades, keeping baby's body close to parents, tummy to tummy. There are different positions that may work better for you and your baby. You will find what works best for you, and it may change as they grow and become a more efficient breastfeeder. Before you go home, we will also teach hand expression, which can help increase supply or feed a sleepy baby. If you're having difficulties such as sore nipples, a sleepy baby, or concerns about your supply, we'll use our breastfeeding care map and provide individualized support. Sometimes a medical condition means a baby needs temporary formula supplementation. Examples include very low birth weight, low blood sugar that doesn't improve with breastfeeding, or certain rare metabolic conditions. If supplementation is recommended, we will explain why and document your informed consent. Before you go home, please bring your preferred formula from home. In keeping with international guidelines, we do not send formula samples home. We're happy to teach you how much and how often to feed, safe preparation and storage, various methods to supplement your baby such as cup feeding, spoon feeding, and bottle feeding, responsive bottle feeding to avoid overfeeding, and paced bottle feeding, allowing for your baby to feed at a more natural speed and therefore showing fullness cues on a bottle, similarly to breastfeeding. There is no judgment, only support. If you need help increasing or maintaining your supply, we may suggest more skin to skin, feeding or expressing more frequently, ensuring 8 to 10 or more breast stimulations a day, improving latch and positions, and hand expression or pumping. If pumping is recommended, we will show you how to use the equipment, clean it safely, and store expressed breast milk. Before discharge, we complete a comprehensive feeding assessment with you. This includes observing a feeding, checking latch, suck, and swallowing, making sure your baby's getting enough milk, reviewing feeding cues and signs your baby is full, and creating a plan if challenges arise. We will also confirm your newborn follow-up appointment. For feeding support at home, we may refer you to such resources as PRHC's Outpatient Breastfeeding Clinic, Community Lactation Consultants, public health programs, early on centers, and the Latch League. Please reach out early if feeding becomes painful, stressful, or confusing. Getting help quickly makes a big difference. Feeding your baby is an important and personal part of early parenthood. Whether you choose to breastfeed, express milk, formula feed, or combine methods, we're here to help provide evidence-based guidance and compassionate care. At any point, if you have questions during your stay at PRHC or once you're home, please contact your care team. We're here to help every step of the way.